With the spread of COVID-19, countries around the world have faced an incredibly difficult trade-off between health and economic concerns. And this has been especially stark for Pakistan, where 24% of the population lives in poverty and large swaths of the population are dependent on daily wages. For many people living at subsistence levels, there's very little economic activity which can be traded off and still allow for their survival. There's been a lot of great work on tracking the spread of the disease by visualizing infection trends, hospitalizations, death rates, test positivity percentages. And these are all numbers that we're pretty familiar with. But in order to properly manage the lives versus livelihood trade-off, governments need to be measuring the economic impact of disease control measures just as carefully as the disease itself. The speakers who will present their work today have been analyzing the impacts of COVID-19 on people's income, consumption, employment, food insecurity, and more. Analysis has been done on the city, provincial, and national level. And together, this paints a detailed picture of how the crisis has affected the Pakistani population. Before I hand over the microphone to them, I'll just share a few quick facts on COVID in Pakistan to just frame the discussion, and then the experts will start talking and I can hide. So the first cases of COVID in Pakistan arrived on the 26th of February in 2020, which was now 1 year and 3 months ago. It seems much longer. Cases grew steadily until there was a nationwide lockdown enforced from April 1st to May 9th, 2020, which is exactly when at least two of the activities that we'll talk about today exactly when two of the activities that we're talking about today had kicked off, actually. This was the only national lockdown that took place, as it became increasingly clear that such an intense lockdown was not sustainable at that level. In this time, CERP had piloted a SCALE framework with the Punjab government in Lahore. SCALE standing for Smart Containment with Active Learning, and fundamentally revolves around detecting disease prevalence through random testing of citizens at sub-catchment level, and then having graded lockdowns according to the proportion of positive tests in the area. This is again to acknowledge that large blanket lockdowns in countries such as Pakistan are just not possible. There have been three. After the initial national lockdown, the government relied on a strategy of smart lockdown and SOP enforcement to mitigate the spread of COVID in Pakistan. There have been three main waves of COVID in Pakistan, the latest of which currently appears to be subsiding, though there are still strict enforcement of SOPs in Sindh. To date, there have been 920,000 plus confirmed COVID cases and 20,000 plus deaths due to COVID in Pakistan. And although Pakistan is the fifth most populous country in the world, we are ranked 29th in terms of case count and 26th in deaths. So far, it seems that the country has avoided the worst of the disease. And of course, we all hope that that continues. With vaccines becoming increasingly available and the news of continued procurement in the future, there are some signs that we can all be a bit optimistic about the future as it relates to COVID in the country. So at least there's some good news on the horizon there. So the first speaker, the first panelist will be Dr. Ghazala Mansouri to speak about food insecurity in Karachi. I don't think Dr. Mansouri needs much introduction, but very briefly, she's a lead economist in the Poverty Reduction and Equity Group at the World Bank. Her research spans four broad areas, which are rural land, labor, and credit markets, the economics of household behavior, the political economy of participatory development, institutional and governance reforms for development. So I actually had the opportunity to work with Dr. Mansouri on a component of this study, where we built an interactive dashboard which visualized these food insecurity hotspots in Karachi, as well as a host of other indicators that your team had created. I still remember some of the early discussions that we had about these dashboards. We were talking about it just as the first lockdowns were being implemented. It was a crazy time. There was, I don't know how many projects happening at CERP all at the same time. Everything was in emergency mode, needed to be done very quickly. Nobody knew very much about COVID in those times. And everybody sort of was kicked into overdrive that I remember. You had to come up with an instrument and you had this really, really interesting technique for gathering data on some of these important indicators very, very quickly. And a system, you had some ideas about scaling it out to many cities and how this could, become a general strategy for collecting data very rapidly and visualizing it and making decisions in any crisis situation. So, I'd love for you to talk a little bit about, this general system, because that was really inspiring at the time, and that was a lot of what we had built. And then, of course, your findings on food insecurity in Karachi, if you can.
Sure. Thank you, Taimur, and good morning and afternoon to everyone else who's connected. I'm just going to go straight to the PowerPoint because I think that can help guide us through the conversation. Ooh, so host has disabled participant screen sharing. Could host enable it, please? Taimur, can you do that, or is someone else in charge of that?
I do.
No, I think it's okay now, but yeah, there we go. It's now it's allowed. I'm just going to go straight to that, and so I'm just going to walk us really briefly through some of our thinking at the time. I think, Taimur, you really set the context for that very well. We were all in super emergency mode. I also remember a lot of conversations at that time with Ali around social protection, so and what we could do on that front, but we were all really struggling. And the real issue we felt was that this thing happened very suddenly. There were no systems in place that we could detect, no database, no monitoring system that could help us to kind of assess very quickly, or help government really assess need very quickly. Because this wasn't sort of like broad scale. You needed to know exactly the first impact was happening largely in the cities. So what kind of data did we have for these cities? How granular was it? Did we have geospatial mapping? None of this seemed to exist. So national data typically on typical things like poverty or vulnerability is at very high admin levels, right? It's not at the level of the subsidy where you need to actually direct resources. So our first thinking was, how do we do that? And we kind of started with thinking about Karachi because it was the worst affected city in the early months. And we said, all right, let's just focus on the really big issues, immediate issues in lockdown, which is, do people have food? What's happening to jobs? Are there health issues emerging that we could track? And the idea was to build a really simple monitoring system that was granular enough to be, and I'm going to talk a little bit, maybe we'll talk a little bit through the session, about the importance of having granular data, right? And was high enough frequency because things were going to evolve over time, would be easy to use by policymakers, non-specialists, and it could be capable of taking in new types of data over time, right? So that was sort of our approach, and we didn't really know where to start. So after a lot of brainstorming, we thought, all right, let's start. We need phone numbers because there was no way to put boots on the ground. So, and we had no phone numbers. So we created a partnership. We actually reached out to all the big telcos. Many of them were busy or did not want to get into this, get into the kind of thing we were proposing. They were also very ill prepared. They had not done anything like this before. But Jazz agreed to work with us. And with them, we developed what are called IVRs, or interactive voice sort of recordings. They're very short. They take less than a minute to do. And there are 5 questions. These were 5-question campaigns. And I didn't want to show you all the questions, but they're basically, the first campaign was around extreme food insecurity, loss of job, loss of income. The second one was around critical prices of critical food items. And the third one was around water and sanitation services. So things that would enable social distancing. We also didn't want to do these calls completely at random. So we tried to target folks that had a prepaid monthly phone bill of 300 rupees or less. That again does not do a really great job of targeting, but it was at least better than just going with all numbers because we were really keen to reach people at the bottom of the distribution. We introduced these as bi-monthly data collection campaigns. And then the only thing Jazz had was very hard. They had no geospatial information, nor were they used to thinking about these things in geospatial terms. So we finally convinced them that they should give us cell tower location and that we would figure out a way to map cell towers to some admin level. And the lowest we could go to was first at the town level, and then we kind of moved from the town level down to the UC level. The UC maps were not updated. But what we did was we used as much information as we had from whatever data we could get a hold of to update this UC level maps. It was a fairly complicated exercise. So, when Taimur said we were all in overdrive, there's a lot of work by a lot of people to get this stuff done and to sort of map through various mechanisms, cell tower locations to these admin units. And of course, there's some high level decision making that has to go into, what's adequate in this kind of situation. And then the impacts we were looking for were hunger, income loss, access to free food, rations, prices of core food items, and as I said, some interactive. And then the idea was that we would get all this data and we would put it at this granular level on an interactive dashboard that government could use actually to do some policy making. So we were simultaneously in discussions with government, and CERP folks were very much part of that, and Ali was also very involved in that, to sort of discuss how best we could support the Sindh government in doing this. Much of that, in my view, did not pan out very well. But nonetheless, I think the example of having to do this, we showed the dashboard to them. They were very excited about it in principle, but I'm not sure that in the end, they really used it effectively to make any decisions. And that's something, maybe that's a learning for how do you put these kinds of systems in place ex ante, so they're not responsive, but that the government is kind of, it's part of their DNA, it's part of the way they work, right? So that when something like this happens, they just naturally turn to such evidence and move from there. So just, you're all aware of the timeline, but the important thing about this is the bottom panel that gives you the campaigns that were run and when they were run. So the first calls were being made as early as 10 to 15th April. So very quickly after the first shutdown. The first shutdown was fully underway when we started our first calls. Then Ramzan started, a little bit of easing happened. The second campaign, so Ramzan is important because we look at differences in free food access, and that eases up during Ramzan because of all the philanthropic action. Then by the 10th of May, there's further easing of the lockdown. And so these campaigns ran fairly steadily till the 23rd, 24th of June, when we made our last campaign. And at that point, the smart lockdown in Karachi, with the 35 plus UCs that were locked down, had already started. The broad lockdown had lifted. And the interesting thing that happened to us at the end of campaign 5 was that we were going to keep going with these while instituting another kind of survey, just to sort of keep getting this basic information. But very soon after this last campaign concluded, we got a lot of pushback from the telco regulatory authority, basically saying that if we wanted to continue to make the calls, we had to run all sorts of hoops. We tried to run those hoops. It didn't work. In the end, it was like, we just said, all right, enough. So we stopped that initiative. And I think that's a real pity, because this kind of data, it was completely anonymized unless a person, so the way, I should tell you a little bit about how IVRs work, right? So in a way, what we did was we first gave people a call. People got an SMS. Anyone who was being targeted by the telco got an SMS message saying, this is an SMS coming to you from a dedicated number, and we will be calling you to get your situation regarding COVID. I forget the exact messaging, but it was done very nicely. So people knew when they got that call from that particular number that it was not a bad call, and that they had been alerted to this before. If they then chose to respond to the survey, which they could choose to do, or they could just not choose to do, right? If they didn't choose to do it, they didn't choose to complete the survey, their phone number would not be really revealed. But if they did, it would be revealed, and they were told that would happen, right? That their phone number would be used for further tracking of COVID impact. So people were opting in. So there was really no issue with anonymity or issues like that. But in any way, we got a lot of pushback on that. And so we stopped the calls, and then we moved to a different strategy. At that point, we had about 200,000 phone numbers across Karachi, which we thought was a sufficient sized sample for us to start going to a more detailed survey. So that's where we partnered with CERP to do a phone survey, a sort of a computer-assisted telephone interview, which was about 20 minutes in length, so allowed us to get a lot more data. So here we get then much more detailed data on employment and income loss by sector, by type of worker, a whole range of health impacts, including sort of like, comorbidities, anxiety, depression, broader health issues, ability to access health systems during the shutdown, and then also ability to social distance, and then of course, food insecurity. So this data, the arrow is a little bit dashed because we have not uploaded the CATI survey onto the interactive dashboard, but we do intend to do that in the future. At the same time, we also began this process of improving the geospatial data through two initiatives. We had German Space Agency data that's the hotspot mapping, but it allows actually to us to assess not just the building footprint, but actually building heights and so forth. So square footage can be much more, is available at a much more detailed level. So we did that for Karachi and Lahore. The problem was that it was relying on population data from the global population counts, and that was not quite accurate because the census data had not been updated for Pakistan. And then we started this new initiative, and maybe I'll get a minute to talk about it, which is we started actually a proper mapping of all of the Kachi Abadis of Karachi. And we also implemented a Kachi Abadi community survey. This happened a little bit after the summer, but we realized when we did this COVID monitoring that we really had no idea where the real areas of need were. We had some idea where the big Kachi Abadis were, but we wanted to be able to map them very carefully to actually understand for the future what sort of needs would emerge across a city like Karachi. So we now have a full mapping of all Kachi Abadis of Karachi updated, and we've also implemented a community level survey, which has given us a whole range of information actually on things like the types of water and sanitation facilities that are available in these Kachi Abadis, whether they're in environmentally dangerous areas, whether they would be more subject to flooding, all sorts of other issues that are of interest looking forward to future concerns about potential disasters beyond COVID, right? Because this is, and we can move into the whole issue of, how should these systems be used and developed for countries like Pakistan that are at very, very high risk for climate incidents and climate risk broadly and used by the government. So I don't know, I want to be very careful. I think I'm already almost out of time. So Taimur, if you could please tell me if I have a minute more or whether I should stop and give you some highlight of results, or.
I think you're all right on time.
Okay, I'll take another few minutes, yeah?
Yeah.
So, so this is just basically, I'm gonna run you through the kinds of things we did. So this shows income loss, and basically none of this comes as a surprise to you guys, right? In the early days, basically 65% of respondents were reporting losing all their income due to COVID, and that's not surprising because everything was shut down. And Karachi is a city of massive informal employment and wage employment. Overall, some 41% of respondents were reporting going to bed hungry during the first lockdown period. The interesting thing we found was that the actual, there's some kind of what we call COVID-associated hunger, which is hunger that was occurring as a result of complete loss of income, partially chronic hunger and partially COVID hunger, which was people who were experiencing hunger but had only partial income loss. And then there was a small fraction, 2%, who were experiencing hunger with no income loss. We actually checked that against the highest, and we find very similar numbers in the highest. So that was comforting because we wanted to get a sense that the data, this was all part of checking that the data coming in was reliable. By late June, reports of hunger were still quite high, but they had fallen from 41% to about 35%, right? So this is sort of hunger. I'm not going to spend much time on it. I want to show you one thing which is interesting. The one thing that we did find was that social protection systems, right, in food distribution worked really interestingly. So if you were part of that group of people who was chronically hungry, you got much better access to free food rations. But if you were a new COVID person, but hungry only because of COVID, because of new income loss, and you did not typically access those systems were not available to those people. There was very poor access, right? So in a sense, one of the important lessons from this is that there are some people who are plugged into some existing, philanthropic or other social protection systems, and they may be okay in times of disaster, but how successful is the system in reaching out to people who are really confronting that disaster for the first time? And there we see that there was much poorer access, right? So this 33% among those facing COVID-associated hunger. So you see that the second bar on the right-hand side is about 26% of these folks were facing COVID-associated hunger, and almost none of them had very good access to food, right? So that remained kind of a consistent pattern. We also defined an indicator for severe deprivation, which was that you lost all your income and you were hungry and you did not have access to food. And that was about 15% of households that were suffering. And then on the right hand, the maps, I'm not spending much time on these because just for shortage of time, but these are all the UCs are mapped here. And we can basically see that the UCs in red were UCs where you had basically between 19 and 30% of people reporting. So, in principle, the government could have done some geographic targeting, and that's what we were encouraging them to do, is to just at this stage do geographic targeting of free food supplies, things like that, where there were really acute problems. And that I think in the future, this sort of system could really help to move quickly. We also tracked the price of wheat. And here, as you can see, on the left-hand side, we found that the price of wheat was always above the Karachi DC rate for most of the time. And we kind of verified that against data coming from the CPI. We actually requested that data and checked it against the weekly price data. And as you can see, I mean, all three of the lines on the PBS wheat price lie above the DC rate. So price of wheat definitely shot up during that time and stayed quite high. And a good chunk of it was 20% above the DC rate. Okay, so this is a view of the dashboard that we developed with CERP. And I'm not going to spend too much time on it. I was going to show it, and I think we don't have time for that. And then we have the CATI survey that we ran with CERP, and we haven't actually finalized the results on it. I won't spend any time on it, but it gives us current work status. It tells us a lot of details about worker status by education level, by employment type, and not surprisingly, the folks who really lost a lot of their income and were most affected were people who were daily casual wage workers and the self-employed, which by the way together form a very large chunk of labor in cities like Karachi. So a lot of people, so you can see why 74%. But one important thing that I wanted to say here is that while only 13% of respondents were unaffected at the height of the thing, by November, when we run this CATI survey, 74% of respondents were back to work at more or less regular levels, but there is some heterogeneity, in particular the self-employed were folks who were still facing, who had less work, and that's not surprising because not everything was fully open. And of course, some of them may have permanently lost assets. We're trying to track that better going forward. Yeah, I'm not going to spend time on this. We did get some data on mental health, which is kind of interesting because it shows that there was a spiking of mental health issues overall, people being uninterested, nervous, worried, depressed, and that this was much more likely among folks who had income loss. Again, not surprising, but just good to document. And I'm going to stop here, actually.
Thank you. I think the most striking thing to me was identifying that for people who we sort of already know are at the margins and at subsistence levels, they already have some sort of system through which they can access food or other philanthropic or social protection schemes. But sort of the new people who are pushed down below a certain threshold, they don't necessarily have access to those systems, and that's exactly why the types of tools that you started developing here are needed for these kinds of crises, where sort of new populations become under threat, right?
Right. I just want to say that this says a lot about the need for adaptive social protection systems, right?
Yeah.
That and we, that's a whole other conversation. But yeah. Let me stop.
Definitely. Thank you. I'm going to go very quickly through the introduction. I had a much longer one here, but just to keep time on the more interesting stuff. So next, we'll talk to, Dr. Basit Zafar would present his work on the economic vulnerability assessment. In Punjab, Dr. Zafar is, of course, an applied microeconomist at the University of Michigan. Your research is focused on labor economics, economics of education, and household finance. Specifically, his work seeks to understand how individuals make decisions under uncertainty and in the presence of social interactions. And I'm going to cut this story that I have very quickly, quite short. But again, we were in, right as the first lockdowns were happening, and just before, we were all in this crisis mode and trying to figure out what this COVID pandemic is coming. What is it? We don't know exactly, but it's going to have massive consequences for a lot of people. And where can we sort of play a part? How can we help, etc. So again, all of CERP was trying to figure this out. We had started this. We had this idea that we should start a survey. We should figure out the economic impacts of this disease. There's a lot of work being done on disease detection, prevalence, etc. And that's exactly where the priority should be. But we need to also figure out this economic angle. And so I had started trying to put some things together. At some point, an email went out to the CERP fellows from Aruf, the CEO of CERP, saying, this is some work that we're trying to do. Would anybody be interested in helping out? And Dr. Zafar, of course, came back quite quickly with some offer to help, and we very quickly ensnared him into, he really whipped the project into shape, like very, very quickly. Instrument, strategy, sample size. Yeah, well, I think even the idea for the random digit dialing in the end, but that was something that you brought in, and very quickly, you sort of responded to this request for help or expertise, and I think completely out of a sense of your civic duty, you just jumped in and really took the lead on this project. So this is a public forum, so I thought there's one opportunity to at least sort of recognize that, so I wanted to do that. Of course, Dr. Sahar Asad and Dr. LUMS and Dr. Direk Qureshi of USC also joined this, and everybody is really was really important in making this thing happen. So with that very short story out of the way, I just will turn it over to you, Basit.
Thanks, Taimur. And thanks, Ghazala. I think you set up the motivation already for me. And the motivation was exactly what Taimur was saying, that when the pandemic hit, there was no quantitative data, right? At the end of the day, to make informed policy, we need to have some sense of what is going on. And that was, I guess, the motivation behind what Ghazala was presenting. And that was the motivation behind this initiative as well, but more at a national level. Let's go and get a sense of, how is the pandemic affecting individuals on economic and other dimensions, and what kind of heterogeneity there is. So before I got involved, I think there was already some long-term foresight on part of CERP. Like they realized that there was this vacuum and they needed to do something about it. So Taimur and other people at CERP had been thinking about this. And that's when I got involved. So one thing I want to mention, data collection is always hard, but in the middle of a pandemic, it's exponentially harder, right? So what I'm going to be presenting today, there a lot of people were involved here. Some names already you see them on the screen, but there were countless people behind the scenes, like the surveyors, and you have to be adaptive, right? In terms of, you have to always be adaptive with data collection, but especially at a time of the pandemic when things are changing at a rapid pace. So what I want to give you in this short presentation was give you a sense of what the objectives of this assessment of this survey were, what kind of data were collected, and what I think should be the future steps. Because as of now, we've only done three rounds of data collection. So this was a phone survey and was done by CERP. And the idea was to examine the impacts of COVID on households. It's in Punjab because initially when I got involved, the idea was to bring in samples from existing studies that were being conducted by CERP. And most of them were in Punjab. Later on, actually, we ended up moving to random digit dialing. So if I were to go back, because of path dependence, it happened to be Punjab. There's no reason why this could not have been done throughout the country. Actually, in fact, when we went to random digit dialing, because the way we did it, we weren't working with any of these phone companies, so we didn't know where those numbers were registered. So in the sample, actually, of course, because of random digit dialing, you would get numbers from all over the country, but the results that we've been putting out have just been focusing on Punjab because we have a nice time series there. So we have 3 rounds of data collection. The first one happened in June last year around this time. The second one was in October 2020, and the last one was earlier at the end of last year or earlier this year. And after this, maybe Taimur can tell us if there are any plans to continue this or not. But as of now, like I'll show you some results, and I think it's useful to get a sense of what happened over the course of the last 1 year, but we don't have any recent, like, things have gotten worse in Pakistan since January 2021, and I won't have much to say about that. So what were the objectives of the survey? I think the idea was to really get timely updates on the economic impacts of the pandemic on households, and also get a sense of, what are the expectations of their plans for the future, right? So of course, we know what has been happening. That's important in order to inform policy. But at the same time, we want to get a sense of what our households thinking, because at the end of the day, expectations are what are going to be driving future activities, right? To get a sense of, how fragile the situation of households is, how effective the social safety net has been, and to also collect quantitative and qualitative data on household perceptions related to the pandemic. And then we also, because this was an in-house survey, so this phone survey took about 25 minutes. Over time, we added different modules. So in the last 2 waves, for example, we had a lot more questions about vaccines, right? Because in June last year, vaccines were not on the horizon. But then as we moved towards the fall, it became clearer that, soon there were going to be some vaccines. So that's another advantage of having an in-house survey, that, you can be adaptive and you can take out modules or add in modules over time. And then we also collected data on things like mental health, investment in children, and so on.
Did Basit freeze for you guys or just for me?
It has frozen. I guess there's a net issue. Interesting.
Basit, if you can hear us, maybe you could put off your video.
By socioeconomic background.
Oh, so you dropped out there for a second, but I think you're back in there.
Okay. So I think the heterogeneity to me is something that's really interesting. And there is a dashboard. So I would recommend, if you haven't seen this, because I'm only going to give you a snapshot or just like highlights of some results, you can check out the dashboard, and we've been putting out reports as well. I won't spend time on this screen, but basically, our sample varies between the first round. There were issues because we also had samples from other existing studies, but I'm only showing you the random digit dialing part. So round 1 actually had a much larger sample, but we moved to random digit dialing towards the end of round, as round 1 was wrapping up. And after that, the entire sample is random digit dialing. So we had respondents between 1,500 and 2,500 respondents. On most dimensions, it seems to match up well with nationally representative data sets. And I'm happy to talk more about, about a representativeness. And, the other thing that we have to realize is, during the pandemic, the kind of selection that you get into when you do this random digit dialing changes actually. When people were being called in round 1, people had nothing to do. So the response rates were much higher, right? But as the economy recovered, the response rates start going down, and that has implications for selection over time. The other thing I want to mention is, what we did is, and I think that's methodologically quite important, is we started getting consent from people to do follow-up surveys. So when we go to round 3, part of the sample are repeat respondents. And then part of the respondents are new respondents. So in principle, if this were to continue, you can have this rotating structure, right, where new people are coming in and some people are being rotated out. And that, again, has some advantages from a survey design point of view. Let me give you a quick snapshot of the results. As Taimur said, the first wave started in March, April, June, sometime last year. And Pakistan never really didn't have a second wave until recently this year, right? So, and most of our data collection wrapped up by the beginning of this year. So as you would expect, things were pretty bad in the first wave. So 63% of individuals, when they were surveyed in round 1, which was in June or July, they said that they had lost income since February 2020, right? So 2/3 in urban areas. In rural areas, it was somewhat different. About a third of households said that they had lost income. But the time trends are quite different, right? So in urban areas, you see this, I don't want to call it a recovery, but things seem to get somewhat better, right? The proportion of individuals who've incurred some income losses tends to go down over time. but in rural areas, it goes the other way, right? So and the other thing, this is going to be one of my takeaways here is, what this highlights is what we really need to do is have these surveys that are already in place before the pandemic. I tell you what you wanted to have happened is you wanted surveys that were already happening at high frequencies. Because one issue here is, seasonality is going to be a big issue here. And especially in rural areas, income tends to be very seasonal. So it's very hard for me or for anyone to look at this and say how much of this is directly attributable to the pandemic versus other seasonal factors. And unfortunately, because we don't have data before the pandemic, there's no way to take out the seasonality. So, and actually that's going to be one of my takeaways here, that I think it's very important to have like surveys that are done in steady state, so that, the next time a crisis hits, we already know what's going on, and then we can take into account those things. Okay, this is Ghazala was also talking a little bit about heterogeneity. The impacts, not surprisingly, are quite heterogeneous. I showed you here results differ depending on whether you look at urban or rural areas. They also differ depending on whether you look at by education. So if you look at the more educated individuals, the initial impacts were much larger, but whether you want to call it a recovery or the trajectory seems to be much more positive, and things are pretty stagnant for lower educated households. In terms of expectations for households, this is when we surveyed these individuals in wave one, and this is their expectations about month-ahead earnings. Things were pretty, in households were pretty pessimistic, right? Because think about like the first wave at the peak of the first survey wave at the peak of the pandemic wave in Pakistan. Households were quite pessimistic about the outlook for the income month ahead. Over time, I think households still say pessimistic in the short term, but they expect that in the long term they'd be able to recover most of these income losses. Now, whether that actually happens or not, we won't be able to say, because as of now, there are no plans on the horizon for more data collection. Food insecurity is pretty high. And again, not surprising, it's in rural areas where food insecurity tends to be much higher. And depending on how you look at this, it seems that things have gotten worse. Things were quite bad in the first wave. They got better in the second wave of the survey, which was in September. But at the end of last year, things were starting to get worse in both urban and rural areas. Taimur, do I have about 5 minutes?
Yes, you should be all right.
Okay. So very quickly, we've talked about the pandemic affecting income, but the pandemic is also affecting individuals on many other dimensions. So what happened was, when the first wave hit last year, a lot of these vaccination campaigns were suspended. As a result of which, about 12% of households which had children said that they had missed required vaccines for their children. And as is, the vaccination completion rates are pretty low. And then on top of that, you have this pandemic, which is having these negative spillovers in other domains that got over time much, much better, because my understanding is that a lot of these vaccination campaigns had restarted last year. I don't quite know what is going on now. Again, consistent with this, when the pandemic hit, for whatever reason, individuals stopped going out to seek medical assistance when they really needed it. Worryingly, things had reverted back to these levels by round 3 again. Something that jumped out to us in the survey is, levels of depression are quite low. These are self-reported levels of depression, are quite high, I mean. In round 1, 42% of individuals said that they had felt anxiety, depression, or loneliness in the past 7 days. It's gotten better, but still a quarter of respondents are saying that they still they feel depressed or lonely. So that's to me a pretty high level. Okay, I want to talk a little bit about the social safety net, and the main source, at least during the pandemic, was SARS. So this is of the individuals who ended up applying for this program. What were their outcomes? About a quarter of applicants in both urban and rural areas said that once they applied, they did get cash assistance from SARS. About 2/3 were rejected, and a small proportion were waiting to find out what was going on. Okay, so what do these people look like who actually end up receiving assistance from SARS versus those who don't? And this is, again, conditional on applying. So if you look at the first column, right, these are recipients and these are non-recipients who were rejected. Yes, it is the case that SARS recipients in relative to non-recipients are in much more dire situations, right? So 50% of them have suffered income losses. The levels of income are very, very low. So one way to interpret this table here is this: yes, the safety net is sort of doing what it is supposed to do. It's reaching out to these people who are in pretty dire financial states. But another way to look at this is, people who are unable to receive assistance, it's not that their situation is much better, right? So there are multiple ways to interpret what I'm showing you here. Okay, what I want to wrap up with is, something that is going to become increasingly policy relevant, which is what are households' views on getting vaccinated. And as I mentioned, we started gravitating towards these questions in the second wave, and then so these same questions were asked in the second wave and the third wave. And the red bars here are the distribution of responses in the second wave, and the gray responses in the third wave. So what you can see is over time, people have become more certain about what they want to do. So in round two, a lot more people said that they were unsure as to what they wanted to do, 20% of people. But over time, of course, I think a part of it is because when we asked these people in September what they wanted to do, there was talk about vaccines being developed, but they weren't really on the horizon. By December, January, it became pretty clear that it was only a matter of time that these vaccinations were going to become available. So I think households had more time to think about this. So what has happened is over time, from round two to round three, more households have become certain about what they want to do. Part of these individuals are fairly certain that they want to get vaccines, but you also have a large increase in the share of individuals who are saying that they're not going to get vaccinated. And then the question is, why is it that they don't want to get vaccinated? So the most common reason that is cited by individuals are safety concerns. So more than 50% of individuals who say that they don't want to get vaccinated cite safety reasons as a determinant for the decision. Another reason that is cited by a lot of people, I don't quite know what that means, is they say they have a healthy immune system and they're not concerned about getting COVID. There's a lot of heterogeneity in these responses. And again, we actually have written a blog about this. And to me, I think you see a lot of pretty interesting insights there, as well as by heterogeneity, by income, and by socioeconomic background. But I think what I want to say here is, I think one implication of these findings is that as more people get vaccinated in Pakistan, and they see that, safety concerns, most people seem to be doing fine. I think hopefully individuals who cite safety concerns, that proportion would go down, and that would encourage more people to get vaccinated. And I'm happy to talk about policy implications of this. So what are the policy takeaways? Again, with the caveat that these results are a little outdated in the sense that I don't know what is going on the ground right now. But at least, based on the data that we collected over the course of the last year, there has been a recovery of sorts, but it's quite incomplete, and it's very heterogeneous by location as well as by SES backgrounds. And the levels of financial fragility and insecurity are very high. I didn't show you that many results. Vaccine hesitancy remains quite high, and it's primarily driven by safety concerns. So we actually also asked people if their favorite religious leader or political leader gets vaccinated, would that encourage them? Would that nudge them or not? Those kinds of things actually are not very effective. And that's consistent with what the literature typically tends to find with these kinds of campaigns also. It doesn't seem the social safety net is doing sort of what it is supposed to be doing, but at the same time, there seem to be a lot of people in dire needs who are not able to get access to the social safety net. In terms of methodological takeaways, and I can't emphasize this enough, is I think it's really, really important to have permanent high-frequency household surveys. This was initiated because of the pandemic, but I've already mentioned the issue is because we don't have pre-data, pre-pandemic. We don't know how much of it is seasonality, and it's very hard to attribute, the exact magnitude to the pandemic directly. So I think it's really important to have in steady state these surveys. And given the times that we live in, data collection is so much cheaper now that in terms of cost, it's not very expensive. But someone or policymakers, someone has to invest in these things. And I think the second thing, which is quite important that for me, is I think understanding the heterogeneity and impacts is really, really important. Because at the end of the day, we care about effective policy design. And that can only be done if we really know what is going on, how different groups are being impacted. So I'll stop there. Thank you.
Thanks, Basit. I think we got a couple of questions, and I'll save them maybe for the Q&A sessions. But thank you for presenting all that stuff. I think all of our the slides, the dashboard, and all of that is available through the CERP website. You can, for people who are listening, if you make your way to the CERP website, then there's a COVID section there. And the economic vulnerability assessment will have all of our findings, the instrument, the survey instrument we use, the dashboard, which is interactive, etc. So everything is there for people who are interested. We'll move next to Dr. Ali Cheema. Dr. Cheema is one of the founding members of CERP. There's a lot of actual things. One of the founding members of CERP, a senior research fellow at IDEAS, the faculty director at the Google Hub Research Center at LUMS, a co-lead academic of the IGC's Pakistan program, member of the board of trustees of the Institute of Development Studies at Sussex, and you were the chair of the economics department at LUMS from 2004 to 2010. And I think there are more, but I will cut them a bit. Your areas of research include economic development with a focus on human capital, inclusion and economic mobility, gender, public economics, comparative politics, economic history, and the economics of crime. And again, I'll cut my sort of anecdotes short, but in the middle, again, it's hard to emphasize like how much of an overdrive mode everybody at CERP was in right when the pandemic hit. And there's many projects happening at the same time. Of course, we were doing some work with Ghazala. Of course, Basit came in on the economic vulnerability assessment. There was this scale work. And Dr. Cheema was in the middle of all of these conversations for sure. And I came several times to Dr. Cheema for a lot of questions, advice, and when I was stuck. And somehow in the middle of all of that stuff, he always found time to dish out some advice to me and just be a very helpful person in that entire time. So again, you don't get many opportunities to publicly thank people these things, so I wanted to do that. It did mean quite a lot to me. So Dr. Cheema, I guess you'll be presenting some of the work that you did on a national level, right? So Ghazala was talking about Karachi, Basit talked about the Punjab level, and you looked at some of the PBS surveys at a national level.
Thanks, Taimur. I actually thought, since the PBS findings are more or less sort of pretty much in line with the findings that Basit presented, although obviously the PBS survey is a nationally representative survey, and it has a different methodology, but it covers a sort of similar time period, that it may not be very useful to just sort of give the granular results. They're out, people can read them. I, along with Maha Rahman, have written a blog on them, but they're pretty consistent with what Basit was saying and sort of what Ghazala was saying. So I think the messages are not different. What I thought I'd do was to take a step back, because economists love to talk data methodology, but I'm assuming that this sort of webinar is reaching out to non-economists as well. So it may be good to just reflect on, what kind of challenges these findings tell us that we've experienced during the past year, basing myself on the rich evidence presented by Ghazala and Basit, and to draw out the implications for the future. So how do we think about what we've just heard, and how do we think about going forward? So the big learning for me from the past year is that the economy and society remain fragile. So there are two stories, and one story is that we're very resilient. This is a very short-term effect, and everything is going back to normal. I think what we've heard tells us that the economy and society remain fragile. The second big thing that I think comes out is that there are serious dislocations that we need to find solutions to. So it's not like a temporary shock. There's some dislocations that are showing up in the data that Ghazala talked about, and then Basit talked about. So let me kind of summarize some of the critical fragility and dislocations. Part of that is going to repeat what Ghazala and Basit have said, but I want to kind of list these out in order to go towards looking at the future. The first thing is, how do we really think about the pandemic shock in Pakistan? And I think people have really struggled with this, because Pakistan has been a bit of an outlier because we never experienced the health surge that has been experienced globally, but even experienced regionally. I mean, we've ducked basically the health surge. What that did was that actually the lockdown periods that both Ghazala and Basit were talking about and that the PBS survey covers were very short periods. We had very short duration, large-scale lockdowns, right? And I'm going to talk about an exception to that in a minute. But we had those sort of last summer, and then we've had those recently. And I think around the time that CERP's EVA came out, that the PBS survey came out, there was a kind of complacency. And the story, the phrase that was being used was that we've experienced a V-shaped recovery, that we've recovered, right? The economy is resilient. But if anything, the third wave has told us that the economy remains fragile to economic consequences of repeated health shocks. We can't think about this whole phrasing of a V-shaped recovery assumes that the shock happened at a point in time. But what we're experiencing are the consequences of repeat health shocks. So you're going to get health shocks which create a surge on the medical capacity, the national medical capacity. When that happens, the government is forced to lock down the economic system. This has become abundantly clear after the third wave when we experience another round of lockdowns. The second big thing, which I think is really important, and this is kind of coming out of the CERP EVA, and I'm sure when Ghazala sort of puts out the results for Karachi, you're going to see that there, and it's there in the PBS survey, is that even after a quarter after the first wave, the labor market dislocations that were experienced had not sort of fully recovered at the household level, right? So, what are we saying? And let's kind of put this together. And this is both from the CERP EVA and PBS survey. The scale of the income shock experienced by citizens after the first wave was huge, particularly urban citizens. The recovery hadn't happened by the time that the PBS survey happened, CERP EVA happened, the third round happened. So the PBS survey happened. I mean, the period it's covering is November 2020. CERP EVA is about a month and a half after that, the third round. You see a stagnancy, you don't see a full recovery. The third thing is that the recovery has been uneven and it's showing heterogeneity. I mean, Basit has talked about one of these things, which is sort of the less educated have not experienced the rate of recovery that the highly educated are experienced. Two things that show up both in the PBS survey and the EVA survey, which are important. One Basit has talked about, which is the pandemic shock appears to be correlated with a rise in food insecurity. And the second thing, which is important, is that there's a debt burden of households appears to have increased over time. So the adjustment was partly happening by adjusting food consumption, and partly it was happening by not paying bills, which is like creating future liabilities at the household level. So what's unclear to me if the recovery of growth, which is what has become everybody's focus, is alone going to be sufficient to overcome these dislocations. I mean, do we just focus on the growth number? Or do we start to really think about how does the recovery of living standards get ensured? And then we have to talk about program design. And I'm going to come back to that in the end. The second serious dislocation, and it's an extremely serious dislocation, is to student education and learning. For the past 10 years, Pakistan has struggled with an out of school children problem. That problem just went out of the roof during the pandemic, right? Because massive amounts of children have been out of school at all levels of education. And actually the lockdown of the education system has been much longer than the lockdown of the economy per se, right? So as my friend Tahir Andrabi argues that this is a real tragedy of the pandemic. But this tragedy of the pandemic is yet unacknowledged. Now, why should we worry about this? And there's kind of great work done by Tahir Andrabi, Daniels, and Jishnu Das, who looked at sort of post-earthquake recovery. And this is the 2005 earthquake in Azad Kashmir. And they looked at what kind of was learning recovery and cognitive ability recovery 4 years after the aftermath. And their findings are pretty instructive and something that gives us a lot of food for thought and concern. What you see is that enrollment recovers, and it recovers actually quite fast, but actually places which had received the shock don't see a recovery of cognitive ability. So those children fall behind. And the second thing that they find is that in those areas, the inequality in education increases post-shock, and it's highly correlated with the education levels of moms or mothers. So households with educated mothers actually start to recover at higher rates. Households where you have illiteracy amongst mothers and low levels of education, they remain pretty stagnant. So again, it's unclear to me if just sending kids back to school is going to be a panacea for the out of school children problem that has been experienced under the pandemic. The third, that there is evidence, and both Ghazala and Basit have talked about this. And I've been also involved in surveys in Lahore with my co-authors Sara Khan and Chandana Khan Momand. We had a kind of a representative sample of households from Lahore, in which at the household level, we'd surveyed both men and women, and we've kind of done repeat surveys using phone methodologies. And for example, one thing that we find was that there was almost a third of households in our sample, women stopped complying with antenatal and postnatal health visits. These were sort of women who were either pregnant or had delivered babies, between kind of May and November, which was also the time period of our survey. Again, we know that this has large effects on sort of children's health as they grow. And we both know that cognitive ability shocks and shocks, in utero shocks, basically can then lead to poorer lifetime consequences for these children. So the question for Pakistani society and the state is, how do we build back better, given these dislocations and the fact that the pandemic does not seem to have an end date? I think the problem is we think the pandemic actually has an end date, but what's become clearer to me over the year is that it hasn't. And the answer to me is that we need to prepare for a new normal. So what should that preparedness look like? And I think at the heart of it is really building capacity to fight pandemics must be a key focus. And what will that take? It really means financing and creating capacity to produce and deliver vaccination programs over the long run, right? The important thing to understand is that these vaccines, the COVID vaccines, don't give you lifetime immunity. So we're going to go back into a loop of boosters in about, 8 months to a year. And then we may need repeat boosters after that. So we're not talking about one-off programs. We're talking about creating the capacity of regular programs over time. The second thing, which is there, and this kind of is the experience across the border, then you can have aggressive mutations coming about, which then will force us to continuously innovate and deliver, right? So the government has made an impressive start on the vaccination program with it started it. And I have to really acknowledge yesterday's announcement by Asad Umar to accelerate the program. So they put in money. Until about a month ago, that didn't seem to be the case. There was hesitancy. Yesterday, they made an announcement. But actually, that's just one announcement. They have to, in this budget, to me, make an announcement of how do they set up a regular program. And as an important part of setting that up is exactly what Basit said, which is to address vaccine hesitancy. Right now, the numbers are looking good because the government keeps reducing the age in which people can enter this program. But it's not the case that all over 70s have actually been vaccinated. All over 60s have been vaccinated. So there are huge holes in the vaccination program at different age groups that started earlier. And I think vaccine hesitancy remains a big challenge, and we need to figure out ways to address it. We also need to think about recalibrating schooling. So if pandemic shocks are going to be repeated, can we go back to the model of large-scale schools? And how do we address the problem of this kind of missed year when kids go back to school? Is the same learning mechanism sufficient to actually get cognitive ability up? That's not what the evidence from the Kashmir study tells us. We also must prepare for the fact that opening up the economy is unlikely to lead to full recovery. But here I want to second what Ghazala and Basit said about sort of surveying and really doing an effective diagnostic of this problem, because we really don't understand the frictions that are causing the heterogeneity and that are leading to incomplete recovery. So we can't design effective programs till we understand what those frictions are. So these are kind of some examples of what we need to focus, in my opinion, to build back better. But what's clear to me, and everything that I've pointed out, that building back better needs a new social contract in Pakistan. Because at the heart of it is going to be critical public investments and the need to socialize risk. And in the fractured social contract that Pakistan has, Pakistan will always struggle to actually put public investment at the center of building back better. So I want to kind of end with a nice quote, which is not very optimistic, but it sets up a way of thinking. It's a quote by Keynes, who said that, you know, when you have these crisis moments, the difficulty lies not so much in developing new ideas as in escaping old ones. So to me, the old idea to escape here is that we can return to the old way of doing business. And I think if we can move past that, then, you know, we can sort of start to construct innovative ways, including building data systems, including sort of creating coherent governance systems, which obviously in this talk we haven't talked about, but which are part of the problem over here. So let me stop there.
Thank you, Dr. Cheema. Yeah, I think actually the takeaway from all three of the talks is not the most optimistic, right? I mean, the data that's been collected by everybody at the labor market level, your analysis just now on sort of the massive hit that all human capital investment has taken in Pakistan, and there are sort of, you know, quite bad implications. I mean, there are implications for the future growth of Pakistan because of these sort of hits that human capital investment has taken. For example, you know, education gaps is the biggest one there, not doing antenatal, postnatal health visits, etc. So I guess these are sorts of things that you would expect to play out over a much longer period of time, right? These are sort of generational things. So I guess I would just open one question, I guess, to everybody. Could you just talk a little bit about the implications of your findings for the future growth of Pakistan, right? So I think one, Dr. Cheema, I think you've talked about it quite explicitly, but maybe if we could start with Ghazala or sorry, Dr. Mansouri or Dr. Zafar on what exactly, how would you tie sort of some of the things that you're seeing, and what are some implications, what are some of the interactions with what you're seeing in terms of, you know, unemployment levels, food insecurity levels, etc. And future growth of Pakistan as a country.
Yeah, thanks. So my sense is actually that we may or may not have pandemics anytime soon again. We may, because we've kind of unleashed this process of getting you know, zoonotic diseases into the system just by the kinds of changes we've made to the environment. So we may have heightened that risk, but there are other risks on the horizon, right? Karachi had in 2020, while COVID was underway, a massive flood, right? Floods, droughts, land degradation, these things are going to become, the whole region, South Asia, is seen as the highest risk region for climate-related disasters across the board: India, Pakistan, Bangladesh, Nepal, the whole region, right? Temperature rises. We're already seeing some of the heat wave effects. We already have over 1 million people in South Asia, and Pakistan gets a nice chunk of that, dying every year because of air pollution, right? Way, way more than COVID, right? So I think that I also want to just say that these sorts of, the thinking that we have to do, right, has to actually move to sort of like building, what are we doing in the broader sense, government responsiveness, sort of systems, not just for social protection, but for broader level of building resilience, adaptation, and so forth. So I think it's sort of not to focus too much on the negative story only, but I mean, disaster resilience essentially is going to be a very important part of growth, of sustainable growth, right? We can have these growth spurts and then go backwards. I mean, globally, poverty rose quite dramatically for the first time in 3 decades, right? In the last year. There's the first evidence we have of a rise in extreme poverty, right? So which we were kind of dealing with very well. We'll see the numbers for Pakistan when the next highest comes out, the next full highest, but I expect it to rise. But the question is that, as Ali and Basit also noted, that this kind of has an effect on sustainability, right? Because these kinds of dips and rises mean that, you have reversals on very key issues that may have generational or intergenerational effects, right? So I think just thinking carefully about these issues, this requires a kind of a dedicated conversation on its own, but it's trying to put this on the horizon. There are other problems well underway that we also should be thinking about.
I think just to add to this, and I think what both Ghazala and Ali were also saying, I think the issue is that even before the pandemic, a large proportion of the population was like, levels of financial fragility were already very high. People just don't have a cushion. So any shock, in this case, it happened to be the pandemic, as Ghazala is saying, I think climate change, weather patterns are becoming much more uncertain and unpredictable. And that has implications for, how predictable your income is and all these things. People just don't have a large chunk of the population just does not have the cushion to deal with these kinds of shocks. I think that's one thing. And I think the one other thing which I worry about going forward is I think inequality is already very high, but these pandemics have a disproportionate impact on different subsections of the population. Ali talked about education, right? Disruption. You've had the same in the US, and the impacts tend to be more, I'm talking about the US because I have a better sense of what happens here, because I should have been clear, I'm not a development economist. As Taimur was saying, I got pulled into this because of my survey expertise. But I think the point that I want to make is, think about education. The impacts are very heterogeneous. And richer households always have the resources to deal with these things. So going forward, the levels of inequality are already high, but they're only going to get worse. And that has serious implications for the economic function of just for the social fabric of society. And I do worry about that.
Taimur, I agree with, I don't see kind of this as pessimistic, but it's a call for action, right? That's how I see it. And one other way to phrase what Ghazala was saying, which I completely agree with, is that we need to think about being adaptive, right? I think the name of the game is being adaptive. Each of these shocks that Ghazala was talking about, the pandemic itself, requires us to adapt. How will universities look like tomorrow? That's a struggle we're having at LUMS right now. Do we open up? Do we not open up? Sort of in what form do we open up? When can we fully open up? But the thing about adaptation is that if you don't bring the public sector into it to equalize, then it's going to become very unequal, because households that have the resources and the networks will adapt, but the households that don't have the networks and the resources will be left behind. So that's where you need the public sector to come in, to act in the public interest to equalize, but on a range of dimensions, as Ghazala was saying, not just sort of pandemics, public health, water supplies, the ability to bear rainfall shocks. I mean, that's a huge shock that Karachi bore 2 years ago. It's at risk of bearing every year. When it happens, we have 5 days of intense conversation and blaming each other like massively, and then we forget about it. But all this requires adaptation and building systems to enable us to adapt and also to change behavior. So, because it's not just, sort of the soft side is equally important. I have a nephew who's like leading cardio globally. And he says the thing that really had a big effect on sort of people's cardiological health is basically people giving up smoking, just the lifestyle change, right? So, here we're again talking about sort of lifestyle adaptations that will need to be made on each of these fronts. And that's not something that the state can coerce. It has to kind of have a conversation and get people to realize the value and adapt. So I think public health programs and awareness programs have a big role. And that soft side of the conversation also has to happen.
Thank you. Yeah, that makes sense. I'll switch over to some of the questions that everybody's asking online. So one question is, how has Pakistan's federal government and specifically provincial governments looked at these findings? And the question is for Dr. Ghazala and Dr. Basit. And I guess more specifically, what I'm interested in as well, because we know that there was some interaction between the government and sort of the tools and the data and sort of the things that we were finding. And I'm also curious at an abstract level, how do we make this click a bit better, and what sort? And I think this is a difficult thing to talk about, but where might some of these roadblocks exist in an abstract way, and just your thoughts on how governments interact with some of these things. So Ghazala, I guess we'll go to you first with this.
Sure. So yeah, I think they didn't go very well overall, I would say, right? And I've always been wondering about why. And I think that the reason is that in the midst of a crisis, there are many voices that are kind of in the mix, right? And governments are not necessarily, like in Pakistan, I think, in the habit of using data to guide policy, right? That habit or state of mind is not in place, right? They don't believe the data half the time, right? Or data is very often seen as a challenge rather than as a tool, right? So it's like, acha aap ye keh rahe hain, but what does it really mean? Right? Are these numbers? They don't just, there's no inherent like take up, I feel, of this. And so that sensibility needs to be built, right? It needs to be built in government, and it's a really, I actually think it's a big task, and that we don't take it as seriously as we should, right? None of us, right? In the World Bank, in a way, we have to, right? Because we kind of interface with government on data, but even then, it's largely national data, and I think that there's a big role for just improving basic monitoring systems, the reliance on evidence for designing policy, the use of monitoring systems. This is a huge agenda, and we cannot possibly build an adaptive system without this, right? Without really good, reliable evidence that people can go to, look at changes and go back to. So I think that maybe one of the big things we should be thinking about going forward is exactly how is that to be done, right? Because in the midst of the pandemic, it was difficult. I think selectively governments took up, we had a lot of success in the conversation with them, but I'm not sure that they actually used the information, right, to do anything substantive with it in terms of food distribution. And that was disappointing in a way. But yeah.
Thank you. Basit, we did have a few conversations about getting the data that we put together into the hands of decision makers. Is there anything you can reflect on
that? Right. So I don't, given that this is not my core area, I usually don't interact with policymakers. But I know in this particular case, I don't know if Maruf is in the audience or not. The survey was picked up by policymakers, and Maruf, for example, and possibly Taimur, you also spoke with policymakers. But one thing that I want to, something that Ghazala said, as economists, what I like about what we do is, we work with data. Data is objective. And at the end of the day, you hope that data would be used to inform policy. But the sense that I got, based on things that I heard, even though I didn't directly interact with policymakers, is, you would think data would help the government or policymakers in terms of informing policy. But the thing that I also got is something that Ghazala said is like many times it's viewed as a challenge by policymakers because there is a narrative that policymakers want to push, and sometimes the data doesn't support that. And you would think a rational decision maker would update once they get new data, but I don't see that happening. So I'll just stop there because I feel Ali and Ghazala have a lot more to say about this.
So I kind of broadly agree with Ghazala and Basit, but I think there's some sort of positives that came out of it. I think NCOC, although it adopted a different methodology from CERP scale, has actually used data quite a lot. I mean, they use it kind of a different threshold. They had a, they didn't do community-based testing. That was the big difference. They relied on hospitalization figures. So it wasn't sort of representative information. They were always constantly being pushed that the testing data is very selected. It may be wrong. There were risks to that approach, but I think that's been an important thing. They've used triggers very effectively. And I think NCOC was also good because it was a federal forum. So it had the provincial and the, sort of national. So it's an institutional innovation, and I think we need to reflect on that carefully. Perhaps a similar system at the provincial level could have been better with effective local governments in play, which, we were dealing with a situation where local governments are very truncated or did not exist. The second thing, which I think Ghazala said, which is actually very important, you need to have a policy framework in place for governments to do something. So if you come in and you say, let's run a food security program, and they don't have the money, and it's not part of their existing agenda, then for them to coordinate this to respond is actually going to be very different. So we're hit by two things. We're actually pushing levers that they don't have control of, or it's very costly to construct. And you need to do those very quickly. And then the data is showing you are not being able to do this. So the first thing you should, even if I was in their shoes, the first thing I do is to say, I actually don't want to deal with this data. It's really good. I'm going to listen to it and then forget about it because it's just hard to do. All that tells me is that the policy framework has to be crafted. And that is an important part of the preparedness of being adaptive for different types of shocks. And I think we need to have a conversation about what that policy framework ought to look like and the public financial moorings and the governance moorings of that system. Because, you can create something on paper, which is indicative, a claim of intentions, but you just don't have the institutional foundations or the fiscal foundations to deliver on it. And I think that conversation is an institutional conversation that has to happen now.
One other thing that I thought about here was, what really are the consequences of not using some of these, not using this data, right? I think, sometimes we would get some traction with the EVA data when it seemed like there would be some immediate consequences, and it was usually when, a narrative was being countered, right, by some of the data. And I think maybe this, I don't know enough about the Karachi work, but this here you can see the consequences quite clearly in some of your data, Ghazala, that people that you knew about, and maybe people are quite confident and like, yes, we know exactly where the people are that we need to help out. They're the same people that they were before, and we have systems there, and then the data just shows you that there was there's actually other people that you completely missed. There's gaps in those things, but I mean, if that gap doesn't cost you politically, then I don't know, what is the incentive to change. So that's just another thing that jumps in my mind, and I don't know what the solution of that is. But one next question here on the group is from Dr. Aliya Khan. So going forward, what kind of data registry do the researchers suggest that would help in targeting social protection innovations more efficiently? So that is for the room, I suppose. I think I will forward this to Dr. Cheema, I think, first, because you talked a little bit about systems that we need to be put in place.
Actually, the person who should be talking about this is Ghazala.
Very fair.
So yeah.
No, Ali, I think we've all talked a lot about this at various points. So look, I think that Pakistan is actually in some ways very fortunate, right? Because we have this, partly because of all the terrorism and whatever, we have this system of this national identity card. It's biometric, every phone number is attached to it, every bank account is attached to it. You pretty much cannot do a transaction without it being recorded somewhere. Now, there is a positive side to that, right? Which is that it would be relatively easy to put together a large-scale system. I mean, that's kind of what we started with the IVR, that look, every phone number, we could have used all sorts of phone data to do really creative things. We can certainly use it as the basis for building a national monitoring system that actually could be very adaptive and quick, because some of the core things are already in place. Most countries are just struggling with that, right? We've gotten trapped in this kind of idea of a national registry, which is this very clunky way of proceeding. You don't need that anymore, right? Between the kind of data we could have with geographic density, the granularity, just work out the geospatial stuff. I mean, you can observe everybody's roofs from the sky at this point, and yet we don't have proper geospatial data. Like, I don't know what we're hiding, right? It's a mindset, right? More than anything else. So if we can overcome these mindset issues and make sure that the data privacy and anonymity issues are taken care of, right? That these systems are secure, only those who need to see them, right? Those are not difficult issues in Pakistan right now at all, given the technical capacity and other things. So a lot of these things are like, these pieces are in place, right? It's a matter of like using them creatively to set up a system that doesn't wait for the next disaster to activate itself and then scramble to say, okay, what data should we use, right? But set it up now. And I'm hoping actually that that's the direction in which we'll go collectively, and that maybe researchers have a role to play there, right? To say, look, here's the global experience. Here are Pakistan's kind of like strengths in building such a system. But let's move away from old ideas, as Ali was saying. I think giving up ideas is so much more difficult than moving to new ideas. So I think we got to get them, sort of, but I think there is scope for this, because I think the underlying conditions are good, actually. And it's very important work that needs to be done. It could also, by the way, really make this whole business of running quick surveys when needed extremely cheap and easy to do. The cell phone penetration rate from the last highest all over Pakistan is over 98%, right? Over 98% of households have a cell phone, right? They may not all have smartphones and so forth, but the reach out could be near, I would say, complete at the census level.
Yeah, I completely agree with Ghazala. I mean, the thing to remember is that, we get vaccination certificates in like a matter of days after your second dose. Think about what, organizations can do. For example, universities can run, sort of conditional programs of enrollment, which say you have to produce a vaccination certificate for us to open up. And that creates a lot of levers. And that's already there because we have an information system in place, which covers a very large part of our population. I mean, there is a part of the population that's excluded. We need to worry about bringing them in. There are issues of citizenship and so on, which affect a part of the people living over here. That's something we have to worry about, but that's in place. I think we need to think about, again, dynamic systems. I think when BISP was created, the Benazir Income Support Program, which sort of Ghazala was part of that exercise. At that point, there was virtually, this infrastructure was not that robust. And a national poverty census was conducted, which was objective, based on a poverty means test, done by kind of physical visits to households. But the problem with that was updating that is next to impossible. So, we have huge lags. I mean, there's been effectively one national poverty census, and then there has been a sub sort of census in some places. So effectively, that database is like 21 years old or 10 years old. Sorry. So as Ghazala is saying, we have cell phones linked to your CNIC. We have we can get electricity data, consumption data of utilities, combine that with remote sensing, sort of using geospatial systems, and you can do a lot of this very quickly, cheaply, at scale, but also keep tracking this over time. And that just creates like a different level of adaptation. The only thing I would say is that the federal government has the best capacity to do this, but it has to institutionally build the capacity in the provinces also, right? Which means also sort of rules for data sharing, right? We are a federal country, and we have to create this as a federated system in terms of being able to give access to some of the sources for specific purposes. And lastly, kind of stressing what Ghazala was saying, privacy is extremely important. And we have to kind of ensure that there's protection because, at some level, we're also at huge risk of misuse by such a kind of intrusive system.
We're now basically at the end of this thing, but there's one final question from the audience, so I'll just quickly ask that, and then we can wrap up. I think so. The question is, what are the social and demographic features which contributed to a relatively light health impact of the pandemic in Pakistan? Are there features of Pakistani society, even compared to India, which happen to lessen the health impact? And
I can clearly pass on this question because I don't think anybody knows is the fair answer to that question. It's a fascinating, by the way, fascinating, but I don't think anybody knows.
Yeah, I don't have any idea, so that's fair. Anyways, with that, thank you everybody for joining. It's been fascinating and very exciting for me to sit and listen to you guys sort of present your work. Again, the economic vulnerability assessment work is available on the CERP website. Dr. Cheema's work is available on the Mabul Haq Research Center blog. And Dr. Mansouri, I don't know actually if your slides are public or
I think that we're about to kind of produce the final version. So, and just wanted to say that we're going into round 2 and also doing both Karachi and Lahore now. So this mapping work has also been in Lahore. So things to follow. And I will certainly put out, as soon as it's public, we'll put it out.
Awesome. Cool. So with that, I think thank you everybody. And yeah, it's been great. Take care, everyone. All right.